Ambulance service, is the patient breathing?
Being a paramedic is the best job in the world.
I love being able to see that I've made a difference in someone's life.
Meet the men and women of Scotland's ambulance service, serving over 5 million people.
Here goes.
From the Highlands to the borders.
Oh, I'm melting.
From busy cities to remote countryside. Wherever we need help.
I'm just trying to think how we're going to get down to the boy.
We're miles away yet.
Whatever is wrong with us.
Ready, set, lift.
You still with me? Lisa? Lisa, go and open your eyes for me.
You look as if you've been halfway across the Sahara jump.
It's not no way pass out. It's okay, we've got you.
It's been the toughest year they've ever known.
This green uniform doesn't mean that we aren't going to catch COVID and we're not going to become sick.
And they are in demand like never before.
That's the only 2 crews at the moment that are covering this whole area up here.
We're under so much pressure, we're so busy, we're exhausted.
On the front line, every day and night, Scotland's paramedics keep Scotland safe.
Harry, come on, baby.
For the ambulance service.
And alive.
1, 2, 3, 4. Okay, don't give up. This is keeping him going till the ambulance crew can get there, okay?
This time, a high-speed bike crash in the borders.
34-year-old female who has been coming down the dirt track. She's had a head-on T-bone injury against a tree.
A nosebleed causes alarm.
Started coming out my tear ducts, so it's pouring out my eyes as well.
Wow. Impressive.
An 80th birthday ruined. And Glasgow opens up after COVID.
You any good at football?
Nope.
I'll teach you.
Melrose, in the heart of the borders, a beautiful swathe of Scotland full of small towns, rugged hills and dramatic scenery. Paramedics here can attend calls all over southern Scotland. Today, advanced practitioner Mike and paramedic Christine have been called to a mountain bike rider in trouble.
So the patient has fallen off her mountain bike in the woods and hit her head. She's still lying on the ground, however she is conscious and breathing.
The Borders attracts over 300,000 mountain bikers a year. Incidents like this are common.
The injuries can be quite significant. The public are going down maybe 30 miles an hour down these downhill tracks.
We are there several times a week, and just because of the general nature of it, there is normally quite a lot of trauma involved, mostly broken bones. We have had several deaths recently in the hillsides.
The paramedics know the location can present unique and difficult challenges. They have already placed a call to request help from Mountain Rescue.
Do you know where this is like?
Yeah, it's a dirt track for cyclists. The last time I remember it was very steep to access.
So when the call came in, my initial thoughts were, holy hell, I know that this is well off the beaten track.
The caller has identified the location of the accident using a special phone app, which generates 3 unique words for each 3 square metre piece of land in the UK, allowing emergency services to find someone who may be in trouble off-road or in a remote area.
Right, so what equipment will we take?
Collar. We'll just take a collar with us and a normal equipment. That's all we can do.
Okay.
Mike and Christine are still several miles from the patient, Emma. Fortunately, her friends can lead them through the forest to the scene of the crash.
So they initially advised us they thought she had broken her ribs. I thought she had a chest injury, and they said she was about approximately 2 miles and walk up through the wooded trees. And it was basically downhill, it was quite vertical.
We're miles away yet. I take it this is not accessible from down the bottom.
They don't come down here on their bike, do they? Oh, goodness.
So the job with Emma had real challenges before we even managed to approach our patient. It was a hot day. We now have to wear our PPE, so obviously having a mask on makes everything just a wee bit more challenging, so we didn't know what we were going to find.
And when they do eventually find Emma, she's in a bad way.
Now then, tell me exactly what happened, Emma.
I've no idea.
Can you not remember at all?
No.
Okay.
So when she was out, her eyes were closed.
Okay.
And then they were closed for like quite a while, but she was making a lot of noise.
Okay.
Maybe like 20 to 30 seconds.
Okay.
And then eventually, right, like when I was like, can you look at me, and she eventually did.
Eventually able to focus.
Maybe about a minute.
Yeah.
A minute.
So Christine,
5
coming down
minutes.
here, witnessed her wheels giving way here. She's come off. They're not sure whether she's hit the ground or whether she's hit her head off the tree here.
Straight away, we're thinking, okay, has this patient had any head trauma? Is there any physical damage that we can see externally to the face? Helmets, what damage does the helmet have that might tell us they've had an impact? Also, we're then thinking about chest. Is the patient breathing normally? Are the patient breathing fast? Are they breathing slow? Are they able to get air entry in? Are they speaking to me?
Emma, the position that you're in, tell me what's the reason why you're in that position.
It's just comfortable for the rib.
Okay, right. Now your rib is going to be extremely painful, okay, but our immediate concern is that of your neck. So do you have any neck pain at all at the moment?
Oh, no.
None at all. Any pins and needles in your arms and your legs? Bear in mind you are in an awkward position at the moment.
I'm a wee bit kind of, my circulation at my legs and my arms is a bit.
Yeah, it's starting to go. Right, okay. So what we need to do is we need to have a good feel down the back of your neck, good feel down the back of your back, okay? And then we need to consider actually, have you injured your spine, or is there a good indication that you could have possibly injured it, but you're not showing any signs and symptoms, okay? So Christine's just going to feel down your neck, okay? Please don't shake your head, just let Christine know yes, no, as she's feeling down your neck, okay?
Is that all okay?
Yeah, yeah.
We often talk about distracted injuries. So what can happen is if you've got one area that's particularly sore or particularly injured, you may not be aware of other pain or injuries that you have. So it's something to be really mindful, or especially in significant trauma with a loss of consciousness, that there was a huge potential for substantial injuries.
What about down here? That's all okay? So now we feel your neck.
Yeah.
Definitely no pain.
No pain.
In order to examine her fully, Mike and Christine need to move Emma from her crouching position.
So,
I feel lightheaded.
yeah. Emma, how we doing?
Yeah,
Okay. Yeah, you'll be lightheaded. I just want to check your blood pressure, okay? After any head injury, it is important that we try and do all these quick ops quickly, okay?
I feel like I'm going to pass out.
Okay.
It's okay, we've got you.
I've got you here.
Life
Okay,
back.
I've got you here. So that's 98. So that's 100 actually.
That's so when I'm pressing. Uncomfortable.
The paramedics are concerned about a pain in Emma's stomach.
Abdomens are our biggest fear in ambulance service because they're so large, contain that many vital organs, that actually it's a very, very big space to quickly bleed into. So that's one of our biggest concerns, to make sure that the patient has got a soft abdomen, there's no any signs of any intra-abdominal bleeding.
Right, Emma, this is awkward and going on just now, okay? Just take your head forward for me a wee tad. Just breathe away normally, all right?
Okay, I'm just going to shine a wee light in your eyes then, okay?
To better understand how Emma hurt herself, Mike checks some footage shot by one of her friends.
Scream if you want to go fast. Oh! Oh, you all right,
Emma?
Are you okay? Right, call an ambulance. So she stays in that position, and she stays in that, and she's not moving her. Hey, it's all right. Call an ambulance. It's okay.
She's off. I think she has hit the tree.
There wasn't a lot of external damage on the helmet, but she did have a laceration and an abrasion to her left eyebrow.
Let me just take that out of your mouth then. Just stay still, Em. Can you see me, Em?
The crash is more violent than the paramedics feared. Emma needs to get to a hospital for assessment, but Mike and Christine are 2 miles from the ambulance. To move Emma safely, they need more equipment and more people. "75 miles away, paramedic Sean and paramedic technician Natalie are starting their shift. They are based in Ayr. Their first call is from a GP, concerned about an elderly patient at a sheltered housing complex.
Got a 79-year-old female who had been up vomiting all night. Doctor's been out. Doctor's querying possible COVID as well. Probably got a temperature, that's why he's querying COVID, eh?
Yeah, vomiting.
Sean and Natalie have been working together for nearly 5 years.
He's a good laugh. He makes me laugh. He's a good chap. I thought he'd fallen there. He's just cleaning his wall.
That's all we need, eh?
I know. 2 patients. He probably has more problems with me. I talk too much. I'm quite ditzy at times. Did you get me a wee apron?
Yeah, sit here.
Cheers.
I did. Handed it through the back.
Forgetting about me.
Natalie's very good at her job. She's definitely a people person. She could talk to anybody. She doesn't get too stressed out in difficult situations. And she's very, very knowledgeable.
Cancelling main function.
When they arrive on scene, Sean and Natalie can't head straight to the patient, Isabel. Because she has been vomiting, there is an increased risk of transmission of airborne diseases, like COVID.
When we got the call as query COVID, and she'd been vomiting and was quite unwell. So we have to think about our personal protective equipment, so things such as wear masks, wear aprons, wear gloves, and if they have a persistent cough, we're looking to use like some goggles or a face shield.
Inevitably, all the PPE slows down their response.
So we're more in demand just now, but still can only attend 1 patient at a time. So it means that there's a lot of patients waiting longer for us to get to them. And we have to don our PPE before we go into their house.
Hello. We're taking time before we get to the patient, but it's just something we have to do given the current situation. Hello. So how can we help you today, Isabel? As soon as we walked in the door, we could hear Isabel vomiting, which is a kind of red flag straight away. How long have you been feeling like this?
Since 5 o'clock.
This morning. She actually brought anything up?
Yeah, bile.
We looked at her, she didn't look very well. She looked a bit sweaty, a bit pale, and she was actively vomiting. So straight away you're thinking that something might be off. So she's due her insulin.
The crew need to find the cause of Isabel's sudden symptoms.
I know you're not feeling very well just now, but is it okay if I just do some checks on you, darling?
Isabel, can we do some checks on you, my love? I know you're vomiting there, but can we check your blood pressure and things? That'd be all right, sweetheart. Okay.
You in any pain, darling?
No, I just feel sick.
Just this.
Have you listened to your chest? Is that okay?
Right. Do what you want to do. I don't mind.
Thanks, you just breathe away, okay? Sounds nice and clear. How's this at?
They were 95. 18.8 blood sugar. Blood sugar tests can reveal a lot in a patient. So if they've got too low a blood sugar, it's known as hypoglycemia. Too high a blood sugar is known as hyperglycemia. Both require medical treatment.
Isabel's blood sugar levels are too high, and she's struggling to breathe.
You're just feeling a wee bit short of puff?
With her high heart rate and her temperature, that's kind of early signs of sepsis. So it was very important that she got treatment quickly.
Sepsis occurs if the body overreacts to a viral infection. It can be fatal if not spotted early.
A wee trip to the hospital this morning, Isabel. Okay.
Aye.
The decision is bad timing.
Hello.
Oh, it's a postman.
Is it your birthday today?
Tomorrow, I'll be 80 tomorrow.
Well, happy birthday tomorrow, because I'm knowing tomorrow.
Right, Alan, thanks.
Right, mate, cheers.
Hi.
Birthday tomorrow, eh? Oh, Friday. I saw your car's coming through the door. Oh, will we try and get you up to the hospital and get you back out for Friday then, will we?
Aye.
Have you anything planned?
Very good. My cousin Dave ordered a meal.
Get yourself a doctor for your birthday, eh?
Sean and Natalie put Isabel at ease, but she's in a fragile state and needs to get to hospital quickly. On the other side of the country, in Edinburgh, Tom and Donna are at the end of a long night shift. They work out of the biggest ambulance station in the country. The last call of the shift is a nosebleed.
Oh, bleeding. Oh, epistaxis.
Pouring through, he's got an epistaxis.
Third since Sunday. No danger was that his blood pressure. No way.
If it is, it's the wrong way around.
It doesn't go that high.
The patient is a 59-year-old man. He's measured his own blood pressure at 198 over 250.
Normal blood pressure is 120 over 80. So if Johnny's blood pressure was 198, that's significantly higher than what it should be.
That's alarmingly high. That in itself would be a reason to go up to a hospital.
We are clear, and it's going to be a beautiful day. Donna's up. Everybody's up. Rise and shine, it's a beautiful morning. Nice flats, I think. Hello, doggy. Hello, sir. How are we doing?
Oh, not too bad.
What's Muttley's name?
That's Lexi.
Lexi. So, is it John?
Johnny.
What's been happening over the last few hours?
Just constant nosebleeds.
Well, it started on
It started on
Sunday morning.
Yeah, I heard you've had a few.
Yeah.
Yeah, he started bleeding out his nose, his mouth and his eyes.
And was it, I see cotton wool, but
Yeah.
was it one nostril or both all the time?
It was like turning a tap on.
Right.
And it was really heavy on the Sunday. So it was filling up my sinuses and it started coming out my tear ducts. So it was pouring out my eyes as well.
Wow. It's quite alarming when somebody's crying blood, tears. There was evidence of quite a heavy blood loss, the tissues and things beside him.
Because there was so much blood going down the back of my throat, it was coming out of my mouth as well. So there was blood everywhere.
So it sounds like you had a front nosebleed and a back.
Yeah.
Nosebleed.
Anyway, so I went to A&E and they got that sorted out. And it stopped bleeding. Yeah, I came home. Didn't have anything on Monday. And then Tuesday I had a slight nosebleed in the evening. But it lasted about 20 minutes or so.
Nosebleeds aren't usually serious, but when symptoms are as severe and dramatic as Johnny's, they can be a cause for alarm.
Is this something that's been an ongoing problem over the years, nosebleeds?
No.
So it's quite new.
As a kid, yeah. And then...
The crew start with Johnny's blood pressure.
Just relax your arm there, sir. It's 165 over 103.
While that's not as alarming as first reported, it's still a high reading.
I've been taking my blood pressure over the last few days and I've got a note of it for at least twice, sometimes 3 times.
That's quite clever, that. That's quite good. You try to do us out a job. Blood pressure can raise because they're in a panic about the nosebleed, or it may be the high blood pressure caused the nosebleed, because your nose is a bit like a safety valve. It's going to blow at some point. Just put this near you, sir. Get the temperature. 36.9. Right, this is a wee blood sugar test.
Yeah.
Wee sharp scratch. As if you've not lost enough blood, but anyway. Just pinch that to your finger, just for 30 seconds. 7.6. Perfect. I think just where it's the ongoing issue and the reoccurrence of it, and the fact that you're still feeling it's going down the back.
He told, she says, if it starts again, just get yourself back here.
And I think that's good advice, and I think that's what we're going to go for.
No doubt that he needed to go up. He'd had it for a while. There was quite a heavy blood loss, and his blood pressure was really high, so that's 3 red flags that he needs hospital assessment.
Okay.
The crew have a moment to breathe, while Johnny prepares himself for hospital.
Any medication, we'll just take that with us?
Yeah.
Okay, you...
I've got a backpack with everything in it.
Oh. God, there's dozens of them, eh? Well, there's Robbie. It had been a long night, and I wasn't expecting to find what we saw when we walked into the living room.
That one there?
Aye. And the other ones are kind of just a bit like him. This gentleman had shelves and shelves and shelves of robots.
That's right.
Tin plate toy robots. There's a few Robbie the robots.
Is that a thing?
You know,
From the olden days?
if you watch a movie called Forbidden Planet, watch it. It was a movie they say it started Star Trek.
It's not my thing, Star Trek.
Leslie Nielsen, Walter Pigeon. It's a classic space movie. I'm working with a Philistine.
Bye, Alexi.
Right, we'll put you down to the ambulance, sir.
Right, Johnny, take care.
See you later.
Tom and Donna reassure Johnny he did the right thing by calling them.
Generally, it's like pinch your nose for 10 minutes. Is that no worked? Another 10 minutes. Then a further 10 minutes. If it's not working after that, phone us.
Yeah.
Straight away.
If you're unable to stop it with direct pressure, if it's more than a teacup, then yeah, it needs to be checked out. Room at the inn.
Tom and Donna have done all that they can. At hospital, Johnny will undergo further assessment. Back in the Borders, advanced practitioner Mike and paramedic Christine are on a remote hillside treating Emma, who has sustained serious injuries in a high-speed mountain bike crash. It's now been over an hour since the call came in. Mike and Christine know they need to get Emma off the hillside and into A&E as soon as possible.
Good feel at the back of your head here just now, okay? Any pain at all?
No.
Generally, what's talked about is the golden hour, and that is anybody with high mechanism of trauma should be seen within a trauma centre within an hour.
Before they can move her, the paramedics want to put Emma onto a stretcher, known as a scoop, to immobilise her spine and prevent further damage.
Quite often, patients end up with a vertebrae fracture. At any point, that vertebrae can crumble, which could then cause a spinal injury, and patients could end up being paralysed as a result of that.
So what we need you to do, okay, is we need to try and stay as still as possible, okay? I'm going to loosen this bobble at the back of your hair, okay?
We'll extend this one.
I think what we're going to do, okay, the position that you're in just now, me and Christine are going to slide that board underneath your bum, and then we're going to get you to, in the position that you're in, bum shuffle on to the centre of this scoop. Now, it's far from ideal, but neither's been in the moods miles away from the road edge. Grant. Right, okay. So what I'm going to do, I'm probably in the best position to grab your neck, okay? I'm going to hold your neck. We're going to get you to come straight forward, okay? And then we're going to turn your legs round. At all times, I'll be telling you what to do, okay? Okay, and your legs to bum shuffle into there.
Oh, well.
Grand, that's grand. Now.
Right, my lovely. Are you able to straighten your legs? Right.
No. Christine, if I get you, I'll up my legs. That's grand, that's perfect, that's perfect. She's had a head-on T-bone.
With Emma on the scoop, Mike and Christine can check on the extent of her internal injuries.
Big deep breaths, Emma. Painful.
But now they have another problem.
There's elements of your job that are just out with anybody's control. There's no way as an ambulance crew, or even as an ambulance team with support from other crews, we could have safely got Emma off that forest track.
Mike and Christine are in touch with Tweed Valley Mountain Rescue, volunteers who help the emergency services on these hills.
So the situation is that we've got a 34-year-old female who has been coming down the dirt track about 15 miles an hour, has come off her bike, and we think she's had a head-on T-bone injury against a tree, has then had a period of unconsciousness.
And when they arrive, the paramedics can now make plans to transport Emma the 2 miles back to the ambulance and off the hillside.
So we just need hands, pretty much.
You don't need a stretcher or that, no?
Have you got a better stretcher than that?
Aye.
Because that's not great for holding underneath.
No, it's not, and it's very
Would our
slippery.
scoop go in your stretcher?
Hell yeah. Yeah,
Oh, that might be safer.
Just whatever you guys have got that's going to make our life a lot easier. Bear in mind, we've got a lot of terrain to go up and a gradient.
They carry a lot of equipment that we don't carry, such as they've got their stretcher that's got extendable handles. It folds in half, so it means they can put it on the roof of their vehicle. It's far safer.
Now there's another problem. Emma's blood pressure is dropping.
We need the blood pressure to be perfusing the brain, the kidneys, the liver, etc. And when the blood pressure drops, then the body starts conserving and diverting blood from these areas.
Emma is in severe pain. She needs morphine, but that can reduce blood pressure further. Mike and Christine need to judge how much pain relief they can give their patient.
Right, we're going to give you some morphine just now, Emma, okay, but your blood pressure is on the low side and morphine can make that worse, okay? So I'm only going to give you a small dose just now of 2.5 milligrams.
Okay, everybody happy?
Finally, Emma can be moved up the mountain.
Okay. Okay, ready, steady, left. Right, stretcher's just going to come in. Yeah. Ready, steady, lower. Ready, steady, lift.
No more casualties, please.
It's been over 2 hours since the first call came into the paramedics.
Well done, guys.
And it's taken a team of 8 people to get Emma off the forest track and into the safety of the ambulance.
Blood pressure's stable, okay? Me and Christine's biggest concern, okay, is that underneath your left ribs, it holds and protects your spleen, okay? So when you have low blood pressure, our biggest concern is that you've got a splenic injury, okay? And that you can bleed quite quickly from there, okay?
Mike and Christine have managed to get Emma off the hillside just in time.
To be brutally honest, had we not had one of the other women that were on their bikes come and rendezvous with us, then the chances of us actually finding them would have been nil.
From its base in South Queensferry, the Scottish Ambulance Services Ambulance Control Centre, or ACC, handles 999 calls from all over Scotland.
Anything changes, call us back immediately for further instructions, okay?
The initial response and planning for medical emergencies all over the country starts here. It's Friday, and Sarah has taken a call about a woman who was choking on her porridge.
How old is she? Right, I'm organising some help for her now, okay? Just stay on the line.
Sarah collects information that will be relayed to the ambulance crew.
Right. So the first thing that's critical is the patient breathing and is the patient awake. If not, then that's the kind of first thing they need to know. The next thing they know is what's happened to the patient. Tell me exactly what you hear and see her doing. Right, okay, and can she breathe at all? Hello? So sorry, your signal's dropping. Can she breathe at all? Right. Okay. Now, just watch her closely and don't slap her on the back. And if she starts wheezing, making any funny noises or becomes unconscious, then tell me, okay?
As they feed information into the system, call handlers are guided on their responses. Asking these questions does not delay the ambulance response.
So the computer gives us all the answers that we need to. We just input whatever the caller tells us, and then based on that, the system, and the protocols will give us the answers and the instructions we need to give to them. So is it the porridge that she's choked on, or is it just the phlegm that she's choking on? Right. The ambulance is coming as quickly as it can for her, okay? Just keep an eye on her just now. Right, okay, just keep her sitting up then if you can, with her breathing and things, okay? So just try and keep her sitting up.
Sarah is unsure if the crew have arrived.
Hello? Is that them there? Hello?
But she cannot close the call until she is sure the paramedics are on the scene. She checks in with her supervisor.
Alan, just assuming that the crew have got this patient because they've put in notes in saying that they can't find her, but the phone signal was that bad that I can't get her back on the phone. No, she was in a house. Oh, they've got them, that's fine. They've got her.
In choking cases like this, call handlers always advise, don't slap the patient on the back.
If someone slaps them, it might cause them more injury than actually helping them. And you don't know how hard somebody's going to slap them to somebody else slapping them. So I always tell them, don't. Some people are going to do it anyway, I think. Like, most people come on the phone and they go, I've already been slapping him on the back. And you're like, yeah, stop. Don't slap him on the back. Poor wee shame for her. She was choking on her porridge. I had porridge yesterday as well.
Back in Ayrshire, birthday girl Isabel has been vomiting all night and needs urgent hospital treatment. Sean and Natalie must make her comfortable for the journey.
Have you been sick pretty much constant all morning? Yeah. We can give you something for that if you like.
Well,
yeah.
listen, I'll be in.
To stop it now.
And to feel
Let's have a wee look,
better.
will we? So in order to treat Isabel, we decided to give her an anti-sickness medication to make her feel a bit more comfortable for our journey to hospital. Riding in the back of an ambulance isn't very comfy at the best of times. And when the patient's vomiting, as Isabel was, it's not a great experience for her. So we decided to put a cannula into one of Isabel's veins, which can be quite tricky.
A bit nippy down. I think we maybe have to try again, sweetheart. I don't think it's...
No. Oh, here we go.
Oh.
I don't think so, my love.
The girls usually get it there, sweet. You see when
Yeah.
they're...
No, not happening.
Finally, on the other arm, the cannula goes in.
You got it after all.
After all.
We'll get there in the end. We'll get you sorted for your birthday, darling.
And Isabel can make the journey to hospital.
There we go, Cinderella. Okay, I'm going to do a wee boogie.
A wee boogie.
A wee boogie.
Getting a dance as well. Right, you just sit back. That's you.
Right, my love, a wee bump here, okay?
Right, you're going up in the world now. You ready?
But once on board the ambulance, Isabel's condition takes a turn for the worse.
sorry.
No, listen, don't you apologise. It's not your... nothing to be sorry for. You think it's passing? No, I spoke too soon. Right there. Okay. Yeah, of course. We'll just take it slowly, getting up, okay?
Keep the ball.
Absolutely.
We get you back onto this monitor.
Aye, if you do what you've got
And we're going to give you some fluids just through this wee cannula here, okay?
Right,
Just
you do what you've got to do.
All right.
Do what you've got to do.
The exertion of getting on board the ambulance has left Isabel struggling to breathe.
So your oxygen levels dropped a little bit just in that exertion, my darling, with all the vomiting. So if it's okay, we're going to give you a couple of litres of oxygen. Okay. So just goes up your nose, maybe a wee tickle initially, and around your ears, okay?
That's right, that's fine. Thank you very much.
Oh, no worries, any time. I'll just sit this here, okay?
Just in case.
Just in case, yeah.
Yeah, I felt quite sympathetic towards her because it was her birthday coming up on the Friday. But to be honest, she required hospital treatment. A bit rocky, this wee road. And we were hoping that she would get out in time for her birthday so she could celebrate with family if that was possible.
"50 miles south of Ayr is Stranraer. To the west is Northern Ireland. To the east, the vast rural region of Dumfries and Galloway. Life for paramedics based here is very different to their colleagues in the cities.
In Dumfries and Galloway, you're kind of on your own to a certain extent. You don't always have the backup you need right away, so it can be quite difficult at times.
The region was hit hard by COVID.
Everybody knows everybody. We personally went to a lot of houses and people were dying all over the place, which was really quite challenging because you kind of know these families, that you're not just telling a stranger that their loved one's dead, you're telling somebody that you know.
Paramedics Tanya and Karen have attended dozens of COVID cases in the last 2 years. And today, they have another.
It's a red call. This patient is COVID positive, lethargic with difficulty in breathing.
I'll receive control. Thanks very much, over. So, COVID positive? Yeah, so we'll just put on our FFP3s. Yes, I think so. So, the visors are on the side. Yeah.
Tanya caught COVID during the first wave.
That was frightening. I'm young and fit, I'm healthy. I don't have any medical issues, thankfully.
Must be one of these up here then. It's like it's the first one.
I was at times lying in my bed thinking, am I going to be a statistic here? Is this it?
Oh yeah, doors.
Because of the threat of COVID, the camera operator must remain outdoors, whilst Tanya and Karen head inside to assess 61-year-old Stella.
Okay, Stella. It's Tanya here. How are you getting on?
Terrible.
Right. Is it okay if we check you over?
Yeah, just so tired and just truly breathless.
How long have you been feeling like this for?
Well, I tested positive on Tuesday.
Okay.
It's not going up. It just sort of quivers.
Right, okay.
So when we first arrived on scene to Stella, we knew that she was struggling. She was very upset. She was frightened. She looked frightened. You could hear her breathing. Her respiratory rate was raised.
Okay, and I'm just going to go to the base of the lungs here, okay?
Mm-hmm. The first thing you need to do with your patients is try, reassure and calm down. It makes the situation so much better when everybody's calm.
But with all the extra PPE they need to wear, that isn't as easy as it sounds.
What I want you to do is just try and calm down as much as you can, okay?
I will.
How you're feeling is normal for this horrible virus, okay? So
Okay, thank you.
just be reassured at that, okay?
It can be very difficult. You feel like you're shouting at patients a lot because they're struggling to hear you through the mask. Also, patients that quite often need to lip read to understand what you're saying. We can't do that anymore, so it's just all about getting down to eye level, giving the patient extra time to make sure they're understanding fully what you're saying.
After checking Stella's breathing and oxygen levels, Tanya and Karen are satisfied she's not in imminent danger.
With Stella, thankfully, all Stella's observations seemed to be fine. All her numbers were within normal range for a woman of her age, which was good.
We have checked you over, and clinically I don't feel you need to go to the hospital. Good.
It's important when we are dealing with patients that we safety net and make sure that if things deteriorate, she knows exactly what to do and exactly who to phone and look out for signs and symptoms, because things do change, unfortunately.
So if things change and you get any worse, okay, so if you become more breathless, you feel more unwell, then you can phone us back.
Okay. I feel better knowing that all that's what I've said is normal.
Yeah.
Thank you very much, and I'm sorry for bothering you.
No, absolutely, and if need, just phone us back. We're here all day, every day.
I'm seeing it a lot more now. People are a lot more anxious, and that has certainly stemmed off of the pandemic. Patients just seem to be really struggling throughout the whole situation.
COVID continues to challenge ambulance service personnel all over Scotland.
It's still very daunting going out to patients knowing, especially if they're confirmed cases. But it's just a part of the job now, and we just have to get on with it.
In Glasgow, lockdown is over, the football is back, and the COVID-delayed Euro 2020 championships have kicked off. Glasgow Green has been transformed into a fan zone, a place where young and old gather to watch the beautiful game on a big screen and cheer on Scotland's national football team.
Come on, Scotland! Come on!
With Scotland set to play Croatia this evening.
You any good at football?
Nope, too left feet.
I'll teach you.
Paramedic Craig and technician Carly are expecting a busy shift in the fan zone.
I'd never met Craig before. That is the first I'd worked with Craig. So I was excited to be out and have people out enjoying themselves again at a big event outside. It was a lovely day. I was looking forward to it.
It was one of those things I think everybody was quite happy as well to actually be getting a wee bit of a sense of normality again.
It's 2 hours until kick-off, and the crew's first patient has arrived.
How long ago was it?
Like 5 minutes.
5 minutes ago.
But his injury has nothing to do with football.
Have a wee look at it.
I'm not going to do anything sort of just now, okay? I'm just getting a wee look. See?
He's been stung by a bee.
Can I have a wee squeeze at it? Is that okay? Yeah.
Well, they can be quite dangerous if the wee boy was to take a allergic reaction to it. I don't think the wee boy had been stung before, so I think the mum was quite worried that because it was quite itchy and he'd got a little rash around about it, that he maybe was going to take a more severe reaction to it.
I think what we'll do is we'll put a wee bit of ice on it and we'll give you a wee antihistamine as well, I think, which sometimes makes it feel a bit better because it feels a bit itchy just now. Yeah, it usually does.
We weren't particularly worried about it. The wee boy seemed fine. He didn't have any issues breathing or anything like that.
You looking forward to the football? Yeah.
The crew decide to give the patient something to reduce the inflammation.
So the antihistamine, it was a little tablet we gave them, and that was for if they're having very mild allergic reactions.
All right. So that wee tablet takes a wee while to kick in, right? But see that ice, that'll help make it feel better, okay? So I know it's really, really hard, and see when this happens, you really want to scratch it, but try not to scratch it. So what we're going to do is we're going to get our machine in that checks all your body over and sees if it works. Do you think it's working? You're not sure?
We'll soon find out.
But I'm sure it will be. All right. You want any more of that water just now? Yeah. You hold on to that. That's yours.
I think the mum was a bit concerned. Obviously, when it's your child and you're obviously going to start to worry. But giving him a check over, checking his basic observations, reassuring her, reassuring him, having a bit of a laugh with him and letting them know that, we're not worried, so there's no need to be worried at that moment in time.
Right, you pop your finger in there for me. Now see if you watch here, a big wavy line's going to come up from here. And that's what tells us what's happening. There we go. So your temperature's good, your oxygen level's good, and your heart rate's good. So far you pass.
I think sometimes a lot of people, they'll pick up on if you're nervous or you're anxious or you start to worry. So always stay calm, always just let them know that you're not worried, and if you're not worried, they shouldn't be worried.
So I know the thing everybody worries about with things is that there's going to be a big massive reaction. So if there's going to be a big massive reaction, you usually see that quickly. Yep. So within the first couple of minutes of this thing happening, and there's certainly nothing that's concerning with what we're seeing just now. Right, do you want to come and see the ambulance? And then see that button there, that red one, you press that. That's the one. There we go, and then look, when you jump out, you'll see them all flashing, it's a big jump. Oh, and you'll see them all flashing at the front as well.
With 2 happy customers now match ready, Carly and Craig head back out into Glasgow's fan zone, where their next patient awaits.
You're aware of a male choking?
If they can find him. Alcohol is a constant presence in the work of Scotland's paramedics. A recent estimate suggests over a quarter of weekend call-outs are alcohol-related.
Is the patient breathing? Every shift pretty much will get calls that are alcohol-related. I mean, mostly, Friday, Saturday nights, you'll definitely find that you're getting a lot of them, and they can be very challenging.
In South Queensferry, call handler Neil is taking the first drink-related call of his night.
Is the patient breathing? And is she awake at the moment? Right, okay, tell me exactly what happened.
The caller tells Neil that a woman has fallen and hit her head. She's struggling to breathe. There's a crowd of people around her and the caller is starting to panic.
One of the things they train you when you first start is repetitive persistence, and basically it's just saying the same line in the same tone at the same volume just over. So, you'll be saying, is the patient breathing? You don't get an answer. They tell you something else. They start shouting, is the patient breathing? You start talking about something else. Is the patient breathing? Eventually it gets through to them. Is she changing colour? Is she breathing at all just now? Right, listen to me. Is she breathing? Is she breathing? I think when you're taking a call for someone that's been drinking, they're one of the parts that you're having to deal with, but then you've also got all these things that are going on in the background. You could have like 10, 20 people all shouting. Sometimes you've got people that start kicking off and fighting each other while you're on the call. Is she breathing?
The caller says the woman is bleeding from her head.
And is she clammy or having cold sweats? She is, right, okay. And does she have asthma or other lung problems? Okay, I'm organising help for you now. Stay on the line and I'll tell you exactly what to do next, okay?
Sorry, I can't really make it what you're saying.
We've got help arranged for coming as quick as we can. A lot of people come on the phone and they'll be shouting, they'll be screaming, they'll be scared, they'll be anxious, and that's absolutely fine. They can come on the phone, they can swear at you and saying, listen, you need to send an effing ambulance, you need to do it now.
With a crew on the way, Neil must make sure the woman is looked after till the ambulance arrives.
From now on, don't let her have anything to eat or drink. It might make her sick or cause further problems, okay? And just don't move her unless it's absolutely necessary. Tell her to be still and wait for help to arrive, okay? All right, now I'll stay on the line with you as long as I can, so watch her very closely and look for any changes. If she becomes less awake and starts getting worse, just tell me immediately and tell me when the ambulance crew's right there with her, okay? It's about understanding that for a lot of people, this is the scariest situation that they've ever found themselves in. So, we need to be the voice on the end of the phone that calms them down and understands the situation that they're in. What's she doing just now?
The woman's breathing is still irregular. Neil decides he needs to intervene.
I'm just going to do a quick test on her breathing, so if you get everybody else around her to stop talking to her, and every time she takes a breath in, just say the word now, starting immediately. Next one. Next one. Next one. Is that her that's talking? She's trying to talk to you just now. Right, that's fine. Listen, like I say, I'll be here on the line with you, so just keep talking to her, all right? Anything that changes, just tell me straight away and let me know when the ambulance crew's there with her, okay? It's really good. Just keep talking to her, okay? And then I've just gone and hung up on her, so that's great. It's the ambulance service here. Sorry we disconnected. We do have help arranged, okay? But obviously if anything changes, just call us back on 999. Thank you.
Neil is straight on to his next call.
Is the patient breathing? Is the patient awake? Okay, tell me exactly what happened.
Back in Glasgow, festivities are in full swing inside the Euro 2020 fan zone. Crewed together for the day are Craig and Carly. And they've received another call for help over the radio.
You're aware of a male choking?
Yes, down at the gate down there.
Right.
Just jump up in the back of the ambulance, all right? We'll get a wee look at you.
That's good call, Scottish going.
So what's happened? I'm Carly, this is Chris.
Craig.
Craig. Sorry. What's your name?
Kieran.
Kieran. So what's happened?
I feel like I've got a blockage.
We had received a message that they were still actively choking, so obviously we thought that's obviously a high priority emergency.
When it happened, okay. How long ago was that?
Half an hour.
Half an hour ago. What were you eating?
Just chicken bites. Just like,
Boneless chicken?
Bites, yeah.
Okay, and then you just felt that it was kind of something stuck in here?
Yeah, it still feels like it's here.
Is
it? My body just... It's like my body's trying to vomit it up.
He was talking in full sentences and he wasn't actively choking, so we were able to calm down a wee bit.
Is it sore or is it just uncomfortable?
Tight.
Tight, okay. We're going to do a couple of wee checks, so we'll do your blood pressure and do your SATs and stuff like that.
What to do? Do you want to just spin yourself around so you can sit right up against that? I've sat it right up for you and just pop your legs up on the bed. That's the man. Fabulous.
I'll take some details while Chris.
Craig.
While Craig is doing your checks.
It started off that I forgot his name and I was calling him Chris, and then I kind of carried on as a joke to wind him up.
Call him Chris. We've been calling him it all day.
But I genuinely couldn't remember his name. I don't know why I wanted to call him Chris all the time, but I know it's Craig now.
Take it you're not normally as quiet as that?
Sometimes having a laugh with the patients, giving them something to take their mind off things. You know what it's like when you've got a pain or when you've got something that's worrying you. The more you focus on it, the bigger issue it seems to be. So sometimes having a laugh, distracting them, calms people down a bit.
I just get a wee listen into your lungs, is that all right? So just sit back, just nice normal breathing, okay?
So all your checks so far we've done are okay, all right? Your SATs are 97%. Pulse is 67.
Chest is nice and clear.
Chest is clear.
That's where the tightness is. But when I swallow, I feel like it's here.
Okay.
See if you take a big deep breath in. Is it worse or better?
It contracts a little bit here.
You feel it getting tight when you breathe in?
Yeah, it's deep. Like there.
Do you feel like you're struggling to breathe? Are you short of breath with it?
No, but it's making me, whatever's there is making me
Worry.
salivate more.
Okay, how much alcohol have you had?
2 beers.
2 beers? Okay, I'm jealous. Just look straight at me. And I'll just get you to stick your tongue out and open your mouth as wide as you can.
That's quite tight actually.
From what we could tell, it wasn't occluding the top of his airway, and certainly obviously the difficulty for us is that we can't see further down, so it's hard to tell kind of what's actually going on. But what we could check was that his breathing rate was okay, he was getting enough oxygen in and out, and he was still kind of up and about and talking and things, so that was quite reassuring. So we both, you need it all right?
Carly and Craig run an ECG test, or electrocardiogram, to check the rhythm and rate of Kieran's heart.
So I'll just get you to relax, all right, and I'm just going to print out this wee tracing of your heart. Nice and relaxed.
ECG basically is a tracing of your heart, and it tells us kind of what the electrical activity of your heart is at that moment in time.
So as I said, there's nothing that's overly worrying us, all right, but just because of how you're feeling, because you live alone as well, I don't want you going home and worrying about it. So you will get another ambulance to come and get you, take you a wee trip up to hospital, and they'll check you over, all right? No, but I'll let you take them off because it might be sore and I don't want to wax your arms. I'll need to charge you for that.
I'll pop back in your party hat there. Right. A couple of these steps down here.
All right, take care.
Craig takes the patient off to wait in the first aid tent until the ambulance arrives.
It's a horrible feeling though, isn't it?
But a short while later, he decides he doesn't want to go to hospital after all.
We can't force them, they've got a right to refuse treatment. Obviously, we'd given them our advice.
Give your GP a call then tomorrow and just let them know what's happened.
He was quite happy to go home,
Okay.
so up the road he went.
Aye, go for it.
You need to give me a fiver back. I'm only joking.
Tell you what, if you can get my name right, you can keep it for free.
What's his name?
Oh, come on, I'm away.
That was a couple of strange jobs then, eh? What was that? A kid stung by a bee and a guy partially choking. Expected maybe drunken head injuries, fights, broken ankles, someone having a heart attack in Scotland's course.
Well, let's hope that is them scoring.
They will score. Kieran Tierney's going to score. Is he playing? My boy.